World Sight Day 2012 is a very important occasion for all of us in the Caribbean. There are many persons across the English-speaking Caribbean who are either severely visually impaired or totally blind. At the Caribbean Council for the Blind, our best estimates are that close to 180,000 persons across the English-speaking Caribbean are so severely visually impaired that they can't use sight to carry out normal functions like driving, reading regular prints, and recognizing facial features. An additional 60,000 persons, we estimate, are totally or functionally blind. That means that at best they have lost about 80% to 90% of their vision. They can't, or they can only see light or physical movement or contrast. So for all intents and purposes, even if they have some light perception or some capacity to recognize obvious movement, they're functionally blind. These persons are part of our community. They're part of our families. They have the right to education, the right to vocational training, the responsibility. Having gotten those rights fulfilled, they have a responsibility to help with the development of their families and their communities and indeed their countries and the region. But in order for them to achieve those rights and accomplish those responsibilities, they really need the support of all of us. And that is why here at CCB Eye Care Caribbean, we are committed to the principles of Vision 2020, which requires that we achieve a significant reduction in the causes of blindness or visual impairment by 2020. In order to get there, the Caribbean Council for the Blind and its many partners, including Ministries of Health, Ministries of Education, Ministries of Labor and Social Services, private sector and public sector optometrists and ophthalmologists, refractionists and other healthcare providers, are committed to ensuring that every person in the Caribbean has access to basic eye health services on demand. That any person who wants to have their eyes examined should be able to get that examination either in the public sector or the private sector without an extraordinary waiting time. We imagine that a few weeks, a month, should be the longest anyone have to wait to get that kind of examination. And so we continue our work to train as many ophthalmologists and optometrists, refractionists, public health nurses, general practitioners in the principles and practices of quality eye health delivery capability. In addition to that, we're very pleased that after many years of advocacy and development work, we now have almost 100 students being trained to become optometrists, both at the University of the West Indies St. Augustine campus in Trinidad and Tobago, and indeed at the University of Guyana Faculty of Health Sciences in Georgetown. We're very pleased about that because presently the ratio of optometrists to persons living in the English-speaking Caribbean is almost 250,000 persons to one optometrist, whereas in the United Kingdom that ratio is closer to one optometrist to 10,000 persons. We are determined in the Caribbean to get that ratio closer to the ratio that obtains in the United Kingdom and Australia and France and other developed economies over the next 20 or 25 years. And so our ability to get more and more young persons interested in being trained as optometrists is being met with the fact that we have so many currently in training. I'm also very happy to say that over the last couple of years, we have begun the aggressive development and expansion of eye departments and operating theaters across the English-speaking Caribbean. We're developing 2 eye departments in St. Lucia, 4 in Guyana, 3 in Jamaica, 5 in Haiti, and we're looking at the possibility of implementing vision centers in a number of eye health facilities, including 4 or 5 in Antigua, and plans on the drawing board for the implementation of similar facilities across several other countries in the CARICOM sphere. World Sight Day is only a marker to remind us of the importance of having these targets met. And so, as we celebrate World Sight Day this year, we do so fully recognizing that we have a very long way to go, that indeed the training of optometrists, ophthalmologists, and refractionists is only a small step in the long journey that we must complete. If all of those persons who are now visually impaired or blind are going to have a reasonable shot at having their eyes examined and getting any sight that can be restored. But most importantly, World Sight Day means that every person who lives in the English-speaking Caribbean should have a right to sight, and in order for them to have that right to sight, we must have enough eye care delivery systems in the public sector and the private sector across the English-speaking Caribbean. I take the opportunity to call on all governments and providers of health services across these Caribbean islands to ensure that when we plan for healthcare in general, we consider the inclusion of opportunities for eye care services so that it can meet that goal of reducing the overall impact of blindness and visual impairment on our communities in a significant way by the year 2020. I thank you.